Greetings everyone, Andrew Lechner here with Realty One Group, and today I'm at the home of Dr. Terry Silkman, and we are going to be talking about what he does in his business and what he offers. So it has to do with health insurance, and a real big thing that's important for us, and specifically for the independent business owner or independent contractor. So without further ado, Dr. Silkman, why don't you tell us how you got started? What led you into this field?
Well, it's a great question, Andrew. Medical care obviously is a huge issue. It has been a huge issue throughout the whole new millennium thing.
Right.
Probably no bigger political football out there than what healthcare would be.
Absolutely.
And it seems like year after year after year it becomes more dysfunctional, more difficult, more underserving of the two sides of the equation that should be served well, both the producer and the consumer. And I have a history in healthcare, and it's important to me. I've seen lots of catastrophes in people's lives where they thought they had a plan that would protect them, and by the time they went through all of the co-pays and deductibles and other things that they had to pay, they were essentially bankrupt, even when they thought they had a health care plan that would support their needs. And so I guess it started for me with a question one day about how can this continue, and there has to be a better way. And so what we've done is a lot of research in ways that people often don't know about how to make their medical care, or how to pay for their medical care. There are multiple organizations out there that will provide primary care and provide catastrophic or major medical care that are somewhat companion products to insurance. They're really not insurance, but they serve, well, I was going to start to say they serve the same need. They actually serve a better need. They look like things that we were used to when we were kids. Like if you need a physician, it shouldn't matter whether it's an in-network or out-of-network physician. You should be able to get access to your medical benefits and go to the physician of your choice, or the physician,
Or like a PPO.
That best serves your needs. Mm-hmm. We have out-of-pocket zero cost services for a lot of things that in particular now make a lot of sense to either the millennial group or to the, now that we're living in the times we are, to the group who would rather consult with a doctor over the phone as opposed to going into a medical facility and exposing themselves to whatever they might expose themselves to.
Now that is something that has changed due to the COVID pandemic.
Sure,
right?
Sure. Lots of other ways that we get great medical care to people and save them hundreds of dollars, if not thousands of dollars, on their utilization costs, but also often cut their premiums by 30 to 50 to sometimes even greater than 50%. Okay. So
now, who is your ideal client? Who is your, I mean, is it really is independent contractors, business owners, like independent, like real estate agents?
All of the above.
Okay.
I would say anybody who's not Medicare age, because Medicare provides services in a way that virtually nobody can compete with that, the government subsidized portion of Medicare. So anybody below 65 that needs a good medical plan and feels like they're paying too much for their insurance, they probably are paying too much for their insurance. Okay. There are a few qualifiers, I guess, in the sense of people who wouldn't be a good fit for it. To get those benefits, essentially we reduce the exposure to pre-existing conditions. So someone who has a significant pre-existing condition would not be a great fit for what we do on the individual side. Now, I just found out that our company has been so creative that if it's a group, like a small employer with a multitude of, maybe 5 to 50 employees, on the group side, there is no pre-existing limitation. So we're doing an even better job than what we've done in the past to be able to reach out and provide something that's meaningful for people and save them a lot of money, help them to do things in their life that are more fulfilling than buying an insurance company and paying an insurance bill.
Okay, so real quick question, since we're in this COVID era, okay, and there's been talk on the news about whether or not insurance companies will now make, if you've had COVID-19, a pre-existing condition. Have you heard anything about that yet in the industry, and how that could affect anything?
Well, I'm not surprised that the question is coming up. It's not a question that has been referred down through my resources in the sense of what I provide. And the answer to the question is, I don't know. That's an unfortunate consequence.
Well,
of
that's
something-
an honest
something
answer.
that
That's an
may
honest
be
answer.
there. Yeah.
Okay. And so now there's the other thing that rolls around that gets confusing for people, like a layman like me. Okay, and that is we have this enrollment period that we're in right now, and I think it ends sometime like in December 8th or something. But you can enroll with your company any time of the year. Is that correct?
That is correct on the individual side.
Okay.
There is no restriction. We can enroll. It's a month-to-month process, and you can change it month to month. On the group side, it functions like what we're used to. The government provides some additional benefits through what's called a Section 125 option. And so on the group side, when you enroll, if you change, you're subject to making qualifying events and medical exams and things like that, the same as if you have an employer and you don't elect to enroll during the enrollment period that's offered to you, then you have certain restrictions and other things you've got to do. So the answer to the question is on the individual side, no. On the group side, yes.
On the group side, yes. Okay, all right. And so how do people get a hold of you? What's the phone number? I'm going to look into the camera and just give me the phone
so
number.
it's an easy thing. 801-550-9225 is a number that you can reach me at just about any time. And email is terry@silkmanfinancial.com.
And Terry, do you work all over the state, or are you do you work in other states as well?
We're a national company.
So nationwide.
Yeah,
Okay, so it doesn't matter where you are, California, Oregon, Florida. If you're thinking about getting insurance individually or for your company, please give him a call, because I happen to work with him closely, and I know personally that he's a great guy. He's a stand-up guy, and he'll take care of all your insurance needs. Okay? Well, thank you so much for giving us time today, and we wish you and yours a happy holidays. Please stay safe. You know what to do. Bye-bye now.
Bye-bye.